Manager for Birmingham and Solihull Vaccination Programme, and Sandra Fitzpatrick, who's the clinical lead for inequalities for the vaccination programme. Helen, Elizabeth and Sandra will be presenting this webinar on vaccinations. So if I could hand over to you now.
Great, thanks, Diane.
Would you mind sharing the slides as well, please?
Yes, I'll do that right away. Sorry, bear with me 1 second. It's loading, it's getting there.
Yeah, we see them now, thank you.
Great, thanks, Diane. I think you've gone through the first couple of slides, so could you skip on to the slide that says what are vaccinations? I think that's slide number 3. Well, thank you. So yeah, what are vaccinations? After clean water, vaccination is the most effective public health intervention in the world for saving lives and promoting good health. Vaccinations prevent 3.5 to 5 million deaths each year from many diseases, including tetanus, influenza, and measles, amongst others. Vaccines work with your body to build its own natural defences, thereby reducing the risk of getting seriously unwell from a disease. Next slide, please. So what are the difference between vaccinations and immunisations? The words are often used interchangeably, and if you use them interchangeably, you'll be understood. But technically speaking, they do mean slightly different things. So vaccination is the act of getting a vaccine, and immunisation is the process of becoming immune or resistant to a disease through vaccination. Next slide, please. So this video is going to give a brief look into how vaccines give protection against a range of diseases. So I'm just going to mute so Ian can play that. Great, thanks, Ian. So getting vaccinated on time protects you and your loved ones from many serious diseases, including measles, mumps, and the flu. Getting vaccinated also helps to stop the spread of disease to those who aren't able to get vaccinated, thereby protecting your community as well. The smallpox vaccine was the world's first successful vaccine, protecting against the serious and often deadly disease of smallpox. The smallpox vaccination was so successful that in 1980, the World Health Organization announced that the disease had been completely wiped out or eradicated. Next slide, please. So getting vaccinated doesn't just protect you against disease, it also protects your community as well. So when less people are vaccinated, like in the diagram at the top of the screen, more people get sick, which means more people pass on the disease, so it spreads through the community or the population. And when the majority of people are vaccinated, more people are protected against disease, like in the bottom diagram. This means less people get sick and pass on the disease to their friends and family, thereby protecting their community. To control the spread of a disease like measles, for example, 95% of the community needs to be vaccinated to create herd immunity, which means the spread of the disease is contained or controlled. Next slide, please. So how many people are fully vaccinated in England and in Birmingham? Next slide. So we know it's important that as many people as possible are vaccinated to protect individuals and the community. And we know that when less people are vaccinated, there is a risk of more people getting unwell and spreading disease. So this picture shows some of the immunisations given to children in England, and that they're all below that key target of 95%. It also shows that year on year, less children are receiving their immunisations, meaning that more children are at risk of becoming unwell from those diseases and potentially spreading disease through the community. Next slide, please. So that was looking at England, but what about Birmingham? So this slide is about the MMR vaccine, which protects against the diseases of measles, mumps, and rubella. And in Birmingham, that's well below that 95% herd immunity target that we've been speaking about. And in the 2021 to 22 period, only around 76% of children in Birmingham had been fully vaccinated by their 5th birthday. Next slide, please. We also know that from recent reporting that measles cases are on the rise in England. But this is very concerning because measles can cause life-threatening illnesses such as meningitis. As measles cases are on the rise and less people are vaccinated, this increases the risk of people getting ill from measles. This means that it's really important to ensure everyone is up to date with both doses of the MMR vaccine to protect yourself and your children, but also to protect your community by getting closer to that 95% target. Next slide, please. So we can look at another example in Birmingham, this time looking at the COVID vaccine. Most areas of Birmingham are fairly low uptake of the COVID vaccine, but this number changes a lot depending on what area of Birmingham you're looking at. For example, in Holyhead, total uptake is around 50%, and in Sutton Four Oaks, total uptake is around 89%. Next slide, please. Thanks. So it's thought that there are 3 main factors that affect whether people decide to have a vaccination or not, and these are the 3 C's. So these are confidence. If people believe the vaccine works, they believe it's safe, and they trust their healthcare workers and others who make decisions about vaccines. The second is complacency. Do people believe that these diseases pose a risk and that these diseases can affect themselves and their community? And the last one is convenience. So is it possible for people to be vaccinated? Have they got the time to attend a vaccination appointment, etc.? And some examples of what these 3 factors might mean to people are in the boxes on the right-hand side of this slide. Next slide, please. Okay, at this point, I think I'm handing over to Sandra.
Thank you, Helen. Well, this slide lists all the vaccines from 8 weeks to 70 years of age. The link that's on the slide can take you to the schedule for you to have a look at in more detail. Next slide, please. The next 2 slides show the vaccine schedule from 8 weeks to 14 years. Next slide, please. Just wanted to point out here that from the moment your child is born, he or she is being exposed to a huge number of bacteria and viruses every day, as Helen has already mentioned. Your baby's immune system is able to cope with this and become stronger. Vaccines use only a tiny proportion of your infant's immune system. And also to note that vaccines together It's been a routine in most countries around the world. Studies have showed that no harmful effects from administering multiple vaccines in one session. Also, if your baby has a minor illness, particularly doesn't have a fever, your child is okay for them to have their vaccine. So it's not a reason not to get vaccine as long as they're fever free. Next slide, please. So if your child, for any reason, hasn't had their vaccine, the easiest way, and then you feel they're outstanding, the easiest way is to check any missing vaccines by looking at the child's health record, which is the red book. And then you can contact your health visitor, your health clinic, or also your GP practice. Children and young people who have missed out on their teenage vaccine can contact their school nurse, the school immunisations team, or their GP practice and can arrange a catch-up. Next slide, please. Vaccinations in pregnancy. Again, the flu season starts from September to March, so they could have their flu vaccine. And from 16 weeks, it's the whooping cough or pertussis. And any time during pregnancy, you could have your COVID-19 vaccination. I think it's important to say here that it's not the vaccine, but your antibodies that pass from the placenta or the breast milk to baby. So the antibodies are the key things for giving your baby the best start in life. Thank you. I'm handing over to Elizabeth.
Thanks, Sandra. So vaccines are especially important for older adults as you get older, your immune system weakens and it can be more difficult then to fight off infections. So you're more likely to get diseases like the flu, pneumonia and shingles, and to have complications that can then lead to long-term illnesses, hospitalisations and even death. I'm now going to give an overview of some of the older adult vaccinations. Next slide, please. So I'll start off with the COVID-19 vaccine. So the COVID-19 vaccination programme continues to reduce severe disease across the population while helping to protect the NHS. The COVID-19 vaccination is safe and effective, and the vaccine gives you the best protection against COVID-19. There are several different COVID-19 vaccines in use, and they've all met strict standards of safety, quality, and effectiveness. The spring COVID-19 booster campaign ended on the 30th of June, as well as the foreign report of COVID-19, except for those who are 6 months to 4 years old in the clinical risk group. The COVID-19 vaccination offer moving forward will be more targeted during vaccination campaigns to protect those at increased risk of severe COVID-19. If you are at increased risk, getting a seasonal COVID-19 vaccine is the best way to protect yourself and others. Research has shown the vaccine helps reduce the risk of getting seriously ill or dying from COVID-19. It also reduces the risk of catching and spreading COVID-19 and protects against different strains of COVID-19. Seasonal boosters will be offered because protection fades over time and there is still a chance that you might still or catch or spread COVID-19 even if you have the vaccine. So currently we're awaiting further guidance in regards to the autumn campaign and the date the campaign will commence. However, for those who become newly severely immunosuppressed between seasonal campaigns should still be considered for the COVID-19 vaccination in the inter-seasonal period. More information can be found on the link on this slide. Now, how can you access the vaccine? So when COVID-19 campaigns are running, you can access through the GP, pharmacies, hospitals, including Queen Elizabeth, Solihull, Heartland, Woodhouse, and the vaccination mobiles that we have present when they're running during seasonal campaigns. And we update our walking website regularly to inform where the mobile units will be. Next slide, please. So moving on to the flu vaccination. So flu occurs every year, usually in the winter, which is why it's sometimes called seasonal flu. It's a highly infectious disease with symptoms that come on very quickly. It is recommended everyone aged 65 years and over and everyone under 65 years of age who has a medical condition should have the flu vaccination. Those aged 50 to 64 years old will also be eligible for the flu vaccine later in the year in the season to allow those most at risk from complications of flu to be prioritised. Healthy individuals usually recover within 2 to 7 days, but for some, the disease can lead to hospitalisation, permanent disability, and even death. Flu is unpredictable, and the flu vaccination gives you the best protection. There are different strains of flu virus, and strains that are most likely to cause illnesses are identified in advance of the flu season. Vaccines are then made to match them as closely as possible, even if the vaccine doesn't perfectly match the strain, it usually provides some sort of protection. Vaccines are given in the autumn, ideally before the flu starts circulating. There are alternative flu vaccines available for those who may not accept the use of porcine gelatin. You can discuss these options with your nursery doctor, as well as flu vaccinations that are egg-free if you have specific allergies. It's best to have your flu vaccination in the autumn or early winter before flu rates increase. It's important to remember that you need to have the vaccination every year and not to assume you're protected because you had one last year. Again, these vaccines can be accessed from your GP surgery, a pharmacy offering the service if you're over 18 or over. Some maternity services offer it if you're pregnant, and sometimes you might be offered the flu vaccine at a hospital appointment. Next slide, please. So the pneumococcal vaccine protects against serious and potentially fatal pneumococcal infections. It's also known as the pneumonia vaccine. Pneumococcal infections can lead to pneumonia, blood poisoning, and meningitis. At the worst, they can cause permanent brain damage or even kill. Anyone can get a pneumococcal infection, but some people are at a higher risk of serious illness, so it's recommended they're given the pneumococcal vaccination on the NHS. The vaccination is offered to adults aged 65 or over and adults with certain long-term health conditions. This is because you have an increased risk of becoming unwell with the pneumococcal infection. So you can access this vaccination through your GP. Next slide, please. So shingles vaccination. So shingles isn't like other infectious diseases because you don't catch it from someone else. Most of us have chickenpox when we were young, although some of us will not be aware that we've had it. If you did have it, then the virus that caused it can stay in your body for the rest of your life without knowing it's there. If the virus reactivates, it causes a disease called shingles. Shingles can be very painful and tend to affect people more commonly as they get older, and the older you get, the worse it can be. For some, the pain caused by shingles can last many years. Shingles can really affect your life, stopping you from doing all the things that you usually enjoy. And about 1 in 5 people who have had chickenpox develop shingles, and it's more common in people aged over 70 years. People under 70 years of age are at lower risk of shingles, but will become eligible for the vaccine when they turn 70. People aged 80 years and over are not eligible for the shingles vaccination because the vaccine becomes less effective as people get older. However, if you are worried about shingles, speak to your GP. As you become eligible as you turn 70 years of age, you remain eligible up to 79 years of age. Also, just to mention that the vaccine cannot cause shingles in healthy people. So check out the website if you want more information around the shingles vaccine. And currently with GP surgery is the only place that does the shingles vaccination for you to access. Next slide, please. So here's a table that summarises the vaccinations and the age at which you can receive the vaccine. If you have an ongoing health condition like diabetes or heart disease, getting vaccinated is especially important. Vaccines can protect you from serious diseases and related complications, so you can stay healthy as you age. Getting vaccinated can help you, your family and your community stay healthy. I'll now pass you back to Helen.
Great. Thanks, Lizzie. So next slide, please, Ian. Thank you. So travel vaccinations aren't on the routine schedule that Sandra and Lizzie showed you a few minutes ago, but it's still really important to check if any vaccinations are needed for the areas that you're visiting. Travel vaccinations are important to protect you against diseases that are found in other countries that aren't covered by the UK's routine schedule. You can find out which vaccinations are recommended for the areas that you're going to be visiting by clicking the link on this slide. Next slide, please. Tetanus is caused by bacteria getting into a wound and is a serious and life-threatening condition. And the best way to avoid getting tetanus is to make sure that you're fully vaccinated against it. Tetanus vaccinations are included in the routine schedule that we've previously spoken about. And the vaccines are given to babies as part of the 6-in-1 vaccine, to 3-year-olds as part of the 4-in-1 preschool booster, and to teenagers as part of the 3-in-1 teenage booster. If you're not fully vaccinated, or it's been a while since your last booster of the tetanus vaccination, you may need a booster vaccine if you have an open wound, especially if the wound is deep or if the wound is dirty. And you can check with your GP practice, who can assess the wound and decide if you need a vaccination. Next slide, please. University students can be at increased risk of disease as well because they mix with large numbers of other students from around the country and from overseas. That means it's really important for students to ensure that they're up to date with their vaccines and to catch up with any that they've missed before they head to university, make sure they're protecting themselves against disease. Students should make sure they've got up with the following vaccines that are also part of the UK routine schedule that we discussed previously. So they are the meningitis ACWY vaccine, which is initially offered to 14-year-olds, the MMR vaccine, which is initially offered to children sort of before primary school, and the HPV vaccine, which is initially offered to 12 and 13-year-olds. So I think I'm handing over to Lizzie for the next couple of slides.
Thanks, Helen. So getting your vaccine as an adult, so it's important that vaccines are given on time for the best protection, but you can still catch up on most vaccines if you do miss them. If you'd like to book an appointment for vaccination, call your GP, we'll be able to provide further support and guidance. There are also links on the slide if you require further support if you need to register with a GP or have access vaccinations through community pharmacy. Next slide, please. So vaccinations for those born or who live outside the UK. So it's important that you register with GP practice and have any vaccinations on record transferred over to your GP practice and stop if unnecessary vaccinations with vaccinations offered do differ from country to country. Again, further information, ensure you are registered with GP practice and set up an appointment with a healthcare professional to see which vaccines you may need to catch up with the UK vaccination schedule. Next, please. Next slide, please. So, worried about vaccination. So, vaccination is the most important thing we can do to protect ourselves and our children against ill health. Some things you need to know about vaccines are they protect you from many serious illnesses, potentially deadly diseases, protect other people in the community by helping to stop diseases spreading to people who cannot have vaccines. They undergo rigorous safety testing before being introduced. They are also constantly monitored for side effects after being introduced. Sometimes vaccines can cause mild side effects that will not last long, and finally they reduce or even get rid of some diseases if enough people are vaccinated. So again, speak to GP, your GP or practice nurse if you're worried about any vaccinations or your children's vaccines. You can also check out the NHS website for further guidance that can be found on the slide. Thanks, I'll pass back now to Helen.
Okay, thanks, Lizzie. So what can we do to help about this? And that's where the Bolder Healthier Champions come in. So next slide, please. Your role as a Bolder Healthier Champion is to talk about the effect that immunisations can have in our communities and to encourage and support people to follow the routine vaccination programme. Improving vaccination uptake within your communities is really important. So we're asking that as champions, you share these key health messages that we've discussed with you today with your communities. You can also connect people to resources that can help them or someone they know. And finally, you can feed back to us. You can tell us if our information is useful, what other information you think might help, what else we can do to get the message across, and if there's a particular topic you'd like us to focus on. Next slide, please. So it's important to remember that talking should always be done with the intention of helping connect people to the right support and not taking on the responsibility of offering professional guidance. You should always use approved information and try to remain neutral. Don't get personally involved with the people that you're trying to help. Next slide, please. So what kind of things would you talk about? You can spot people who may need your support. You can share these key messages and encourage people to accept the offer of vaccination. And you can promote these webinars in your networks. So on this slide are a few examples or suggestions for how to talk about vaccination within your community. You can ask if people are up to date with their vaccinations, if they know what the benefits of vaccinations are, and if they know what vaccines they or their children are eligible for, with more examples of questions on this slide. Next slide, please. So this is an example of how you can offer brief support and help in your everyday interactions without getting personally involved. It's called the Ask, Advise and Act model, and you can offer brief and immediate support to find out what help is needed and then direct the person to the resources that we've given you. Next slide, please. So sometimes you can help someone best by offering practical support, especially if they're struggling to find the time to research the information for themselves. In this case study, a Bolder Healthier champion who works in a pharmacy is helping an elderly person find the right medication for their condition. And at the end of the interaction, the Bolder Healthier champion mentions the flu vaccine, and the customer mentions they're not sure about their eligibility for it. Next slide, please. So the Bolder Healthier champion points the person to information about how to check their eligibility and how to book an appointment. Next slide, please. So Bolder Healthier champions do the really important job of connecting people to the resources available, whether that's through web pages, services, or voluntary organisations. And next slide, please. And this slide brings together a directory of resources about immunisations. And this might be helpful to support you in your conversations with your community and to help connect people to the right information that they need. Next slide, please. We also want to know where more help is needed so we can continue to improve support for citizens. And as the eyes and ears of the community, you can tell us where more help is needed and how best to provide it. So you can email us through the email address on the slide or connect through social media at any time. Next slide, please. Yeah, so finally, thank you for volunteering to be a Bolder Healthier champion. We hope that you're enjoying these sessions and enjoying supporting your community to improve their health and well-being and promoting positive health. Your role as a Bolder Healthier champion is to share this information into your communities to encourage and support health and well-being. Our champions are advocates for important health messages in Birmingham by distributing this information into a wide range of communities and networks. And we support you through monthly themed webinars and tailored resource packs. We've previously covered topics such as physical activity and how it can be incorporated into our daily lives, the cost of living, and diabetes. If you know someone who might be interested in taking part, then please encourage them to find out more by searching Bolder Healthier Champions Birmingham City Council, or by sharing this link with them when you receive the slide deck. Next slide, please. Yeah, great. Thank you for joining us today. So I'm just going to hand over back to Ian or Ben.
Yes.